explanation of the lipoprotein A ALPA test, covering all the requested aspects. 1. Introduction. Cardiovascular diseases remain one of the leading causes of mortality worldwide. Among the various risk factors, lipoprotein A, or LPSA, is an important genetically determined lipid particle that can significantly increase the risk of atherosclerosis and heart disease. The LPA test helps in identifying individuals at higher risk even when standard cholesterol levels appear normal. 2. The lipoprotein A test is a blood test that measures the concentration of lipoprotein A particles in your bloodstream. LPA is a type of low-density lipoprotein, LDL, that includes a specific protein called apolipoprotein. High levels of LPA can promote plaque buildup in arteries, increasing the risk of coronary artery disease, stroke, and peripheral arterial disease. 3. Indications. This test may be indicated if you have a family history of early cardiovascular disease, have personal or family history of high cholesterol not explained by lifestyle, experienced heart attack or stroke at a young age, 55 for men, 65 for women, have known atherosclerosis with normal lipid levels, are being evaluated for genetic lipid disorders. 4. The LPA test is used to assess a genetic risk for cardiovascular diseases, provide additional information when other lipid tests like LDL-C, HDL-C are normal, help guide preventive strategies in high-risk individuals, evaluate risk in patients with a personal or family history of premature heart disease. 5. Why do this test? Need of the test. Detect hidden cardiovascular risk not revealed by standard lipid panels. Identify individuals who may benefit from intensive lifestyle changes or medications. Support decision-making for aggressive treatment, e.g. statins, PCSK9 inhibitors. Determine need for family screening in genetic lipid disorders. 6. What happens during the test? A simple blood sample is drawn from a vein in your arm using a sterile needle. The process takes about 5 to 10 minutes. The sample is then sent to a laboratory for analysis of LPA concentration. 7. How long for my results? Results are typically available in 2 to 5 business days, depending on the laboratory. 8. Preparation for the testing is not required, but some providers may request fasting if other lipid panels are ordered simultaneously. Inform your doctor about any medications or supplements you're taking. No special preparation is usually needed. 9. Risk to the test. Minimal and similar to any routine blood draw. Possible risks include mild pain or bruising at the puncture site, rarely infection or hematoma. 10. Interpretation of results. High levels of LPA, 50 mg and 25 nanomolar, indicate an increased risk for cardiovascular disease. The results must be interpreted alongside LDL cholesterol, HDL cholesterol, triglycerides, other cardiovascular risk factors like diabetes, hypertension, and smoking. Normal values. Below 30 milligrams per deciliter is generally considered normal. Levels can vary by ethnicity and genetics. There is no universally accepted cutoff, but most guidelines flag 50 mg 25 nanomolar as elevated risk. 12. Factors affecting results. Genetics, major determinant. Levels are largely inherited. Ethnicity, e.g. African descent, may naturally have higher levels. Kidney disease may increase LPA. Hormonal status, e.g. estrogen therapy, may reduce LPA. 13. Clinical significance. Elevated LPA is a strong independent risk factor for coronary artery disease, CAD, aortic stenosis, ischemic stroke. It is not significantly modified by lifestyle, so early detection is key. New therapies like antisense oligonucleotides or PCSK9 inhibitors are emerging to reduce LPA levels. 14. Know more. LPA is not routinely measured in standard lipid panels. One-time testing is usually sufficient since levels remain stable over a lifetime. People with high LPA may need more aggressive cholesterol lowering and lifestyle changes. Research is ongoing into drugs that specifically lower LPA. 15. Conclusion. The lipoprotein A test is a valuable tool in cardiovascular risk assessment, especially for individuals with a family or personal history of early heart disease. Since high LPA levels are genetically determined and not easily altered by diet or exercise, early detection helps in tailoring preventive strategies. As understanding and treatment options evolve, LPA testing plays an increasingly important role in personalized medicine. Thank you. Have a nice day.